This area, as a county, we'll be able to appreciate. There are more other areas we have been able to pick, like the JES clinic, which is currently not functioning for two reasons. One is that we do not have pharmaceuticals currently, and tuberculosis is a program that is being supported from the national government. So we are also asking the national government if they can be able to come in handy and help us get the pharmaceuticals, both for the intensive case and the continuation case management for tuberculosis. And Senator, we have also made a few other observations in terms of what you will be able to help us strengthen in terms of commodity management. And I think your recommendations at the committee level will be able to come in handy. But we want to thank you for this visitation, and as a county, we want to appreciate, because then it opens us our eyes and we are able to make improvement in the areas we have already picked.
Ladies and gentlemen, we are here today as a Senate Health Committee to visit Kisii Teaching and Referral Hospital. And in our course of jointly with the County Assembly Health Committee of Kisii, and we have had a very good joint inspection. We have a number of observations we've made in the facility. You can't believe the services that are being offered in that mortuary. In fact, you can only compare the services we get from the private homes that are run in Nairobi. We've also visited the ICU. And we found the ICU is working well. The other department having challenges at the renal department. We have had patients, there is shortage of equipment, but there are equipment that are not working. That the biomedical department should actually make sure they are working so that they can support the patients. To have renal patients coming to queue is a bit of a challenge, and we think the county management should address that matter. Besides many other things that we have noted that we are going to put into our report. We also decided to do the visit. Our mode of operation as Senate Health Committee is to first visit the facilities before we meet the executive, so that we can brief them of what we have found out. I think the other minor thing that needs to be sorted by the executive of this hospital is curtains. How do you have wards that don't have curtains, surely, in a teaching and referral hospital? That we cannot even blame the CEC. The chief executive officer of this facility is sleeping on the job. I mean, they have what we call revenue generated by the hospital that is being managed within the hospital. So we also expect basic repairs, curtains, these minor things should be sorted within the facility. So,
leo tuko kaunti ya Kisii, ambapo mimi ni mzaliwa wa sehemu hii. Tulipokuwa tukifanya ziara yetu katika hospitali ya rufaa, kwanza nimefurahishwa na mambo ya hifadhi ya mili katika chumba cha kuhifadhi mili. Ningependa kuwapongeza sana kwa kazi ambayo inaendelea pale.
I just want to thank my chairman, Honorable Mandago, and the team that we came with from the committee. Then look for funding which is available, and then we can come and try and improve this facility. This facility for me is so important because I was born here. I grew up here. This facility is so important because if I fall sick now, as I'm standing here, we'll have a problem with the oxygen. We'll have a problem with HDU department. We'll have a problem with some of the departments that we have. It is true, the mortuary is working well.